Righty. We will get started in just a moment. Welcome to all of you who could join us today for our career exploration panel on veterinary medicine. As you may have remembered, if you've been able to join us before or if you have not been able, my name is Shelby Carlson and I'm the 4-H Youth Development Educator for Henderson, Knox, McDonough, and Warren counties over here in Western Illinois. For those of you who have not joined us before, just a little reminder, I have some of our technology on a little bit of a lockdown. At this point, you will find that you are unable to unmute yourself. That's to help keep some of that background noise that we've all experienced on a Zoom call down to a minimum. However, when we open it up for questions with Dr. Stevens, I will change that setting so you can unmute. You also at this time can chat directly with me or with one of our other people who are set as a co-host. I ask that you either chat with myself or with Jill Cook if you have any questions come up. Jill is our program coordinator for Warren and Henderson County, and she's here as a tech aide with me today. So it is 2 o'clock. I am ready to go ahead and get us started. And it's my pleasure to introduce Dr. Kimberly Stevens. She is going to, I will kind of get us started and get her prompted with some questions and let her take away introducing herself and her practice. So Dr. Stevens, can you tell us a little bit about yourself and your veterinary practice?
Yes. So I am Kimberly Stevens, as Shelby said. Thank you for having me. First of all, I really appreciate sharing this passion with you guys. I grew up in Galva, Illinois, and that is where I practice now. So a lot of veterinarians cannot say that, but I was lucky enough to come back to my hometown, which I was a little bit concerned about coming back to my hometown. You know, all the producers saying, I've known you since you were an itty bitty little girl, and now look what you've done. But honestly, it's been wonderful. My producers really enjoy that interaction of knowing me and knowing my family and where I've come from and what we've accomplished. So I appreciate that. I am a mixed animal practitioner. So I see large animal and small animal. I guess to backtrack just a little bit, after I graduated from Galva High School, I went to Blackhawk College East Campus here in rural Galva, and then transferred to the University of Illinois, where I got my bachelor and my doctorate of veterinary medicine. In veterinary school, you can track if you want to do small animals, or if you're interested, I guess, in small animals, large animals, a mixture of both, or what you're most interested in. So I actually did track large animal medicine when I was going to vet school. I thought that I wanted to be a dairy veterinarian, and actually I still aspire to be a dairy veterinarian. But with the milk prices and the cow market as it was in the year that I graduated, there was not any job opportunities really in the entire country for dairy practice. The milk market really took a hit in 2010 when I graduated, and there was just not an opportunity for veterinarians to join a dairy practice. So that led me back home. And like I said, I think I'm where God wanted me to be, and He's put me in this community for a reason. And I really enjoy being here. So I am a sole practitioner, so I own my clinic by myself and I practice by myself. So that is both good and bad. I can make my own schedule and I can kind of take time off as I need to, which Shelby should be laughing right now, as Shelby has been an employee of mine, and time off is really not something that I do just because of the time commitment that my job takes. So, and the commitment that I have with my clients. I mean, that's a personal decision that I have made to be available to my clients when they need me. So I am on call 24/7, Christmas, holidays, all of that. Have definitely done a blood transfusion on dogs on Christmas. A couple Easters ago, I did 3 C-sections, 2 on cows and 1 on a dog on Easter. So, you know, we are very busy and I really appreciate that. I do have the clinic in the background, my kind of lab working area. So in case you see people popping in and out, we are trying to finish up or wrap up a couple cases for the day. So I'm sorry about that. Anything else, Miss Shelby?
I think we can kind of to move into some of that next question, but for those of you who've been with us in previous weeks, we have discovered that those who have any hand in agriculture, including veterinary medicine, no day looks the same and no day is ever calm and quiet. So absolutely, we can see what's going on in the back of Stevens Veterinary Clinic, and this is kind of a great treat to be able to see kind of that backside of the office as well. That many people, when you come in with your pet, don't get a chance to see. So
Yeah,
that's exciting for us.
absolutely. Yeah, we are. Shelly's always shy, never wants to say hi to anyone. But yeah, we are definitely working. You can schedule all day long to have these times to communicate with professionals and to have Zoom meetings, but turns out animals don't really respect schedules very often. And so we are still trying to work through some sick calves and sick cows and our surgery patients today. So.
Absolutely. So Dr. Stevens, I'm hoping you can tell us a little bit, how did you decide to pursue a career in veterinary medicine?
Yeah, I think that every little girl wants to be a veterinarian at some point in their life. When we talk to 4-H kids and clover buds and all that, all those kids, they all want to be vets, right? But what can happen sometimes when kids are growing up is this week we want to be a veterinarian, next week we want to be a firefighter, and the next week we want to be a policeman, and the next week is something different. And it just never changed with me. I've have clients that were my preschool, kindergarten, first grade teacher, all the way through my Galva career here. And I've always wanted to be a vet. I think that the passion of animals and loving animals is paramount, obviously. But to really dig into, yeah, my dog was vomiting at some point, but why is my dog vomiting? And not just feeling sorry for my dog vomiting, right? There has to be that deeper desire to want to help those patients and figure out exactly what's going on with them. And there has to be a lot of commitment. Veterinary school and getting into veterinary school is difficult. And so you have to have the commitment to pursue high grade point averages and the application process and be determined and dedicated to the process, I think is very important. But, I can remember standing in the milk house when my grandpa was milking cows and saying, I want to be a vet. And he goes, yeah, I did too, but financially I just couldn't. And thankfully now there's student loans that can help us out with that. But there are a lot of challenges right now in the veterinary industry. So you really have to have that drive and that passion to be a successful veterinarian.
Absolutely. That is such great insight. What does a typical day look like for you, Dr. Stevens? Or if it doesn't look typical, what could that range be?
Yeah, well, why don't we just use today as an example, Shelby? So today on the schedule, I had 2 spays, a dog and a cat spay. And then I had a couple appointments first thing in the morning. And then we were supposed to have lunch and then had some appointments and then this Zoom call and more appointments in-house. And then what my day ended up being, well, I guess it's not over yet, right? But what the day ended up being is the 2 surgeries. And then while we were in surgery with those, we had 2 animals come in for those appointments. So we did see those appointments. And then we had 2 producers call and say there was a sick calf that we had to go see and a sick cow that we had to go see. So we brought lab work back from those 2 calls. Our clinic mom, Shelly, packed us lunch so we could have lunch on the road. And I guess now we're working up some of those cases still with fecal results still coming in, blood work results still coming in from those cases and still trying to communicate with those owners. But yeah, that's typical to not have any idea what's going to walk through the door or who's going to call.
Absolutely. We can certainly understand that. So Dr. Stevens, one thing that I would love if you could touch on is we've had some interest of people in these sessions, not just from Illinois, but from kind of across the country. Would the role of a veterinarian look similar as across the country anywhere as it does in the Midwest, or how might that vary?
Yeah, I think you're definitely going to have species differences as you move across the country. Your big beef states are going to be, Iowa, Nebraska, Kansas. So you're going to see a lot of feedlot things in those states. Dairy industry is going to be huge in Texas and Wisconsin, and Idaho is now a big dairy state. California, obviously. Swine production's huge in the Carolinas. But one thing we all have in common is that COVID has really slowed a lot of industries down, but COVID has definitely ramped up the veterinary industry because everybody's at home right now and everybody wants a new pet. And so we are more busy, and across the country, practices are just much, much more busy than we've ever been before. So trying to treat and trying to navigate those huge influxes of patients. I'm sure that all of you guys can think of people that have gotten a new kitten or puppy in the last 12 months. It's just incredible, the baby boom that we have seen during COVID.
Yeah, that's absolutely a great insight. I'm sure that is a very common thing that's happening. I know personally, my sister decided to get a new puppy during all of this. So absolutely, I can relate to that. Um, can you share with us some of the different roles that are involved in the overall scope of veterinary medicine? So you absolutely are that veterinarian, but what are some of the other roles that someone might explore?
Yeah. So Blackhawk College recently has a veterinary technician program, and veterinary technicians are basically the nurses of the veterinary industry. And so if you were to go into a hospital, a human hospital, whatever a nurse does in that human hospital, our veterinary technicians are going to do for our animal hospitals. So, for instance, mine monitor anesthesia, they do dental cleanings, they pull blood, they clean ears. I mean, they do everything. The only thing that veterinary technicians cannot do is diagnose and treat. So if it doesn't fall under diagnosing a patient or ordering treatment for a patient, then they can do everything else that veterinarians do. Like, I could trim nails all day long, but that's not going to, help with my. It doesn't. My training is much bigger scope than that. So, I want to diagnose all day and I want to treat patients all day, and everybody else can do all the other stuff. So that's nurses or veterinary nurses, veterinary technicians. Then there's veterinary assistants. So if you think of veterinary technicians as the RNs of the veterinary world, veterinary assistants are the LPNs. So they are supporting the nurses in what the nurses are doing. And then we also have reception staff. Some bigger clinics that board animals will have people like kennel assistants that just walk dogs all day or feed dogs all day. So that's kind of the roles. And then there's some groomers too. But that's kind of the roles in the veterinary clinics. When you specifically talk about veterinarians, there are many, many, many different things that you can do in this career. You can do research if you'd like. You don't talk to a whole lot of people. So for some of my classmates, that was perfect for them. And that's something I guess to touch on, that I hear from students that I want to be a veterinarian because I really like animals and I really don't like people. Well, a lot of our job is communicating with the person that's attached to the animal. So you have to like people too. And you have to be able to build those strong relationships with your clients to have a successful practice. But sorry, that was a little soapboxy, I guess. But so research is one. You can actually teach in academia. So you can teach in colleges. You can teach the further veterinary professionals or the future veterinary professionals. I actually taught at Blackhawk College for a little bit in the vet tech program. And so I was trying to help that next generation come up. So teaching is a place you can go. You can go into industry. So we have to go to companies that make the medications that we use. And so in order for the medications that we use to be made, we have to have veterinarians that are in research and development. So in industry. So that is definitely an opportunity there. And then as a veterinarian, you can specialize. So you can just do dairy medicine like I wanted to do. And all you do is feed dairy cows every day. So there are board certified positions that require additional training and additional education in order to be a board certified. You can be board certified in so many different things: dentistry, cancer treatments or oncology, soft tissue surgery, orthopedic surgery, food animal medicine, food animal surgery, equine medicine, equine surgery, exotics. There's a board certification in, and I'm sure I've missed a ton of them. Oh, behavioralist. There's a board certification for animal behavior. So there's just so many opportunities with veterinary medicine and what you want to do. You can make it into whatever career you want.
Absolutely. And I think as you talked about all those people that help keep this show running so that you can lend your expertise, we've seen great examples of that, of Shelly and Rachel in the background, you know, scurrying around, going a mile a minute, trying to keep things going. So those of you who are interested in this path and are maybe a little nervous about taking that step to become a full veterinarian, you can see some of the valuable work being done also.
Yeah. And I really encourage you, if you're interested in veterinary medicine at all, you know, really find a clinic to work in, because finding a clinic and figuring out what role you want to play in the animal industry is paramount. I've had students, Katie Miller, and I hope she doesn't mind me sharing this, and I don't know if you guys know Katie Miller at all, but Katie Miller, she grew up in Cambridge. She graduated from Cambridge High School, went to Blackhawk College and went to Western. And she's found her way back. She's teaching now at Blackhawk College, but she shadowed me and she's like, you know, I really thought I wanted to be a veterinarian, but as it turns out, I really do not want to be a veterinarian. And I think that those experiences are just as valuable as figuring out that your passion truly is veterinary medicine. So finding a clinic that fits with your end goal. So if you want to be a mixed animal veterinarian, find a mixed animal practice. If you want to be just a strictly small animal vet and do surgeries all day, you know, find a practice that you can actually shadow and see the behind the scenes stuff, because it's not all about petting puppies and kittens. That's for sure.
Absolutely. Thank you for sharing that. I know, as Dr. Stevens said, I have had a chance to work very closely with her while I was in college. And that's something I heard her say to plenty of our students that had come in, was that it's not all about petting puppies and kittens. There is so much more that goes into it. Not that we've ever passed up an opportunity to pet a cute puppy when it comes in, but there is so much more behind the scenes. So Dr. Stevens, you touched on it a little bit, and I just want to make sure, are you still good with the blood work that you've got running right now?
Yeah, I'm standing right next to the lab station, so I'm looking at it as we're talking, but thank you,
Okay.
Shelby.
Yeah, absolutely. Like Dr. Stevens says, veterinary medicine never sleeps, and that includes when a friend asks you to do a favor and get on a Zoom call. So Dr. Stevens may have to take a minute and read some of the blood work that she's got. The great thing is that that's something, and maybe you can talk about some of the in-house diagnostic tools that you have and that you are interpreting, where we know we often get kind of shifted all around in the human medicine profession.
Yeah, and it's something that my human nurses and human doctors and radiologists that I have as clients, they are really shocked by what we have in-house. And so in the front of the clinic, obviously, we have our waiting room that you would have at a normal human doctor's office. We have the exam room that you would normally have at the doctor's office. But in the back, once you come to the back, you know, we have, and I can show you. Sorry, I'm just gonna move it around. So this is our blood work machine. So we have full in-house blood work. And so instead of you getting a phone call back from your doctor after your blood work comes, you know, in from the hospital or wherever you get it drawn, we have it. So in 8 minutes, we have blood work results on our patients if we need it. Over in this area, sorry, I didn't clean up at all for you guys. I do have a really fancy microscope. I love this microscope. If you notice, it's got a screen on top of it. And so this screen allows you to take pictures. So if a dog has like an infected ear or something like that, I can take a picture of what it looks like today. And then when it comes in for its 2-week recheck, then I take a, look at that picture from 2 weeks ago and see, is my treatment working? Or do I need to change treatments? We also have our autoclave to sterilize our surgery stuff. Sorry, surgery is probably still a mess because we did surgery today, but we do have full surgery suite. We just have one table. This is what this thing is called on my surgery table. It keeps our patients warm, and so we wrap our patients in a blanket, and then warm air circulates around that patient. As you can see, we have.
Dr. Stevens, when you're turned away, we have some trouble hearing you.
Oh, sorry.
No, you're okay.
Better?
Yes.
Is that better? Okay. So here is oxygen tank and our anesthesia machine itself. We do have monitoring equipment as well. So our heart monitor, breathing monitor, blood pressure, temperature is all on that black screen right there. And then we do have, kennels here with our 2 surgery patients that we have. And then over in the corner is an IV stand with an IV pump on it, like you would see in a human hospital. So that will run fluids and regulate fluids to our patients. We also have in this room a dental machine. So we are also dentists. So the dental machine is just like you would see, so this right here, just like you would see, right here, just like you would see at your dentist office, is a dental machine. So we have all of those capabilities. We do have an ultrasound as well. It's put away right now, but we can take ultrasounds. We also have an ultrasound unit that goes out to our large animal clients. So we can take an ultrasound of pregnancy for pigs, sheep, cattle, horses. And then finally, the last thing that I wanted to show you is we have full x-ray here as well. So this is digital x-ray. We get an image within 6 seconds of taking the picture. It goes on our computer system and we can show our clients a picture. So we pretty much have a whole hospital here under our roof. Oh, and a whole pharmacy. So your dog needs meds, we can fill them right here. Is that what you're kind of wanting, Shelby?
Yeah, that's great. That is, you guys have all the tools you need to be successful. And yeah, we can see just a sample of those. I know I was most excited when Dr. Stevens got the new microscope that had the tablet so she could capture those images.
It's a great way to monitor progress. I think that if you see, our full schedule is seeing about 30 to 35 patients a day. If you're seeing that many patients every single day, an image from 2 weeks ago, unless you actually take a picture, unless you have a very good memory, there's just no way to gauge whether it's better or not better. So, yeah. It's been very helpful.
And I think Dr. Stevens has a great memory compared to many people I know, but it's not always that great. She also is always taking time to teach people and show you what you're looking at, whether that's crystals in a urinary tract infection or something. But again, that's so much more easier for her to point out to you on the tablet than for you to put your eyes up to the microscope and for her to describe what you're seeing. Dr. Stevens, one of the questions that came into the chat box was, have you ever been bitten? And what's the risk of that happening in your field?
Yeah, so yes, I have been bitten. His name was Pharaoh. He was an intact Doberman Pinscher that had been very nice through the whole exam. I went to check his teeth and I lifted up his lip and I went back and I checked his back molars and the front part of his lip stayed raised. And I was like, that's weird. And then no growl, no nothing. He just latched onto my arm. So, we try to prevent it. We do not allow owners to handle their own pets. We have our veterinary nurses handle pets just to try to relieve or alleviate that situation from occurring. But it does happen rarely. So I have been a veterinarian for 11 years now, and that was the only dog bite I've ever had. Cats are a little bit of a different story. I feel like cats are little ninjas, and they can just squirm their way out of anything. And so cats definitely are a little bit more challenging to handle. There is a movement in veterinary medicine right now called fear-free. And so if a clinic is deemed fear-free, very rarely will they apply a muzzle to a dog. If a dog shows any sort of anxiousness, they reach for pharmaceuticals, so drugs to help that dog kind of chill out a little bit. And I think fear-free is important, and we definitely do not muzzle a ton here, but in a rural situation where we're in, I think that a lot of dogs don't necessarily have the socialization as urban places where people are taking their dogs everywhere with them all the time. They're going to dog parks or meeting new people all the time. So I think, our practice does a nice job, but we are not fear-free certified.
Absolutely. And I think I can say that it's not always dogs and cats that are the risk for you. Have you ever been taken down by another animal of any type before?
Yeah, large animal medicine is it's kind of hard on your body. So I personally have had back surgery. I've had both of my knees worked on. I've had both wrists worked on. So large animal medicine is very, very hard on you. I was putting a magnet, so cows can swallow things that they're not supposed to. So cows are what's called indiscriminate eaters. And so if they grab a mouthful of food, they don't sort through that mouthful of food to see if there's something in it. They just swallow it. And then at a later point when they're resting, they'll regurgitate it back up and then re-chew it. But in that process of being an indiscriminate grazer, they can swallow things like nails and wires and things like that. And so what we do is we put a magnet that's about, yay big, and we put that down into their stomach. And we do that by holding their head and then using an apparatus that has the magnet in it, and we put the magnet in their mouth, and then they have to swallow it. So I was doing this on a 1,400-pound cow, and she wasn't exactly super excited about me hugging her head, as you could imagine. And so she gave me a couple warnings that she wasn't super happy, but I don't know if you guys can tell, I'm a redhead, so I'm a little bit stubborn. And so I was like, cow, this is gonna happen. And the cow decided to pick me up, and she threw her head. So she picked me up and threw me, and I landed incorrectly on my knee and actually blew out all the ligaments in my knee in that process. So things can happen quickly. Things can, happen without notice. She did give me some warning, and I'm just too stubborn to listen to it. I have changed my ways since then, though, so I did learn. But there are definitely many of time that things just happen so fast. There's a veterinarian in our area here that he was checking a horse out, and the horse kicked him, and he had to have knee surgery there. I know many veterinarians have had their pelvis broke by a cow falling on them or something like that. So things happen fast with animals. They're unpredictable. So you just have to be really careful. And if you take somebody like Shelly so I travel with a person all the time now, unless it's after hours. And sometimes that person can be a voice of reason for you and say, hey, Dr. Kim, maybe you shouldn't do this. So, I was in a stall one day with a horse that I was taking its temperature of. It was laying down, and that horse suddenly started having a seizure, and I'm trapped in the back of the stall with it. So things happen quickly.
Absolutely. That is a great thing to keep in mind, not only as we consider possibly a career in veterinary medicine, but some of those other agriculture fields that we have talked about today. where we're dealing with, be it animals or large equipment things, to always be aware of the risks.
Mhm.
Um, so, Dr. Stevens, can you tell us a little bit about what role does continuing education play in yours? How do you stay up to date with what's going on?
Yeah, just like in many industries that have a licensed professional, you have to have continuing education. And in order to renew your professional license, you have to have continuing education. And so veterinarians, we have to have 40 hours in a 2-hour or a 2-year time frame. And then one of those hours has to be sexual harassment training. And three of those hours have to be controlled substance in controlled substance training. And so we do deal with a lot of controlled substances in veterinary medicine. And unfortunately, society has turned now where we do see people seeking out controlled drugs for their pets, but it's technically not. I mean, they are making up conditions that their pets don't actually have so that they can get their hands on controlled meds through veterinarians. And so we are now trained to recognize that, try to help people through that. What organizations do we need to call when those sort of situations occur, and kind of go through that. But the rest of it, most of the continuing education is just about like, what's the current research? What are the current thoughts on a certain condition? And then veterinary nurses also, if they are licensed, they also have to have continuing education. And don't quote me on this, but I believe it's 20 hours in a 2-year time frame.
Okay, so I just put the word into the chat box that we are going to now allow everyone to unmute themselves, if you would like to ask Dr. Stevens a question. You are able to unmute and either raise your hand or just unmute and ask that question, or you can continue to sit those through the chat box for me, and I can ask them aloud as well. The first one that I have had come in while the rest of you are thinking about your questions is that we've got one student who's heard that it's very difficult to get into vet school, even harder than medical school. What is the reasoning behind this?
Yeah, so first off, medical school, there are tons of medical schools in the country, so hundreds of medical schools in the country. There are only 32 veterinary schools in the country, and I believe that does include the 2 island schools that are down in the Caribbean. So 32 versus hundreds, there's that. And I don't know what a class size is at a medical school, but when I graduated from University of Illinois, or actually I guess when I was accepted, they accepted about 120 students, and I believe their class size is still about the same, 120 students. The year I applied to veterinary school, there was 1,300 people that applied for those 120 spots. And so it is very, very, very competitive. So your GPA is very important, but those extracurricular activities that you involve yourself in is also very important. So being able to show that you're a well-rounded person is paramount, but grades do matter. So you still have to keep up with your grades.
Okay.
Oh, Rachel just said there was 1,800 applicants to the University of Illinois last year for 125 seats.
Yikes, that is crazy.
Yeah, it's very competitive.
All right.
So there's going to be my plug for Blackhawk College or any junior college, but junior colleges really fit well with a professional degree model, because you can be in your small class sizes, so you can take your chemistries and your biologies and all that with a class of 20 or 30 kids versus 400 kids at a 4-year university. So you can get your GPA boosted up pretty significantly at a junior college. And I will say that even at Blackhawk College, people say, oh, junior colleges are maybe a little bit easier. And I don't think they're easier at all, because you still have to study and you still have to have the curriculum demands, you just can see your teacher in the hall as you're walking down the hall and go, hey, Dr. Abbott, I have a question about today's lecture. And that's just something you don't get at a four-year university. Sorry, I had to do that plug.
No, absolutely. I know Mila had a question. Mila, did you want to unmute and ask that?
For sure. Hi, Dr. Stevens. My name is Mila Monroe, and I am a colleague of Shelby's. I actually work out of the Champaign Ford Aircoin Vermilion unit. So we are lucky to have the university kind of in our backyard. I wanted to ask you to talk a little bit more about the Not One More Vet movement. I've been seeing a lot of the Facebook ribbons on friends and colleagues and vets that I've used over the years. So if you would just share a little bit more about where that started, why, and just a little more information for everyone.
Yes. So this could be a little emotional, so I apologize, but veterinary medicine is very demanding, very emotionally demanding. It's very physically demanding. And people don't understand that. And I think that society, this has been the worst thing to happen to society in many aspects. But I have had clients that text me on Christmas and ask me, hey, we just got a puppy this morning. How much do I feed my puppy? I don't really care. Today, I don't care. Tomorrow, you can call the office and we can figure it out. But today is Christmas, and texting a professional and asking them that on Christmas, in my opinion, is not appropriate. But so many people, it's just like, right here, oh, I could just text my vet and I'll figure it out. That's hard, right? It's hard. And when I have 3,000 clients, and I actually 2 years ago went to 2 cell phones. And so I now have a personal cell phone and I have a work cell phone because and I kid you not, before I did this, all night after we closed, I was answering emails or texts from clients. And it's stuff that you can see, I have Shelly and I have Rachel. I have very well-trained staff that can answer those questions, but people want to hear from the vet. And I get that. I understand that people want that connection, but what they don't understand is that there's 20 other people that are texting me all at the same time too. And so that is very, very, very draining, and it never allows you to shut off. So as a veterinarian, you need to have personal time and you need to have some sort of release. And if those things are coming in all the time, it becomes very, very difficult to even be around another vet. I've lost friends based on the amount of stress level that I've had and people that don't understand this profession. And it's hard. It's really, really hard. The other thing you have to think about is we have the ability to relieve suffering for patients. And I love having that ability. So many times I get asked, I am sure the hardest part of your job is putting an animal down. And it's not. And I know it sounds terrible, but I get to allow that pet not to suffer anymore. And I get to allow that pet to be at peace. And if you don't have that mindset, it can be very draining. When I was a 4th-year veterinary student, my very first rotation or clinical rotation was emergency medicine. And we have 14 days that we're on. And every single day, I put an animal down. And still, even here, we put animals down very, very frequently. But when you're a student and you don't necessarily see the benefit of putting an animal down, that rotation, man, it really drained the life out of me. And these, now that I'm furthering my career, some of the patients that I'm putting down, I've known since they were a puppy. And that is very difficult too. The other hard part about it is we go from putting an animal down to having to be super, super happy because somebody just got a new pet. So in literally a doorway transition, you have to change your mindset from being sorrowful and empathetic with that owner that just lost a lifelong companion to being super happy and super grateful that someone picked you as their vet for their new puppy. So that's really hard. It's also hard going grocery shopping. It's hard going to church. It's because you're the vet all the time, right? That's how you are identified in your community. And I'm grateful for that. And I have a lot of clients at my church, and they don't see it as not separating my personal life from my career life. But that's also very draining. So you never have a time just to shut off. So because of all of the stresses that occur in veterinary medicine, oh, one last stress. In human medicine, there is the ability to have insurance. And if you don't have medical insurance, there's the ability to go to hospitals or organizations that can help you pay for your medical bills. In the veterinary world, there's estimated only 1% to 2% of pet owners have pet insurance. And so the economic part of pet ownership, people understand that they need to feed their pet every day, but they don't understand that if my dog gets hit by a car, they can't make payments on that. They have to be able to have that emergency fund available to help their patient. I have to pay the lights. I have to pay for my lab work. I have to pay my employees so that their families can survive. And so, yes, I love animals and I do my job because I love animals, but you still have to pay your vet bills. And people still have to pay for emergency situations on their pets. And, you know, veterinarians are one of the lowest paid professionals in you know, professional land. And we are not out for money. Heck, don't tell everybody, but I've lived with my parents for a very long time and just recently was able to afford to move out. And so all of those stressors really culminate to suicide. We have the means. We know how peaceful death can be because we see it every day, and we help animals through hurting and relieving that hurt. And so not only do we have the drugs available, we know how to inject medications and we know how to find veins. And so all of that stuff has really led to a huge problem in our industry with veterinary suicide. So emotional burnout. So we have, and I actually lost a classmate from it. Our profession is 4 times more likely to commit suicide than any other profession. And it sucks. So we have to be aware in every interaction that you have with your vet, or if you're wanting to go into veterinary medicine, that you need to have separation of personal life and career life. You need to have some sort of release. You need to be nice to your vet. You need to be nice to their staff. It is not our fault that your cat is in kidney failure. It's not your fault either. We're just the people that tell you that we've found the answer to why your pet is suffering, and we've given you options to help fix it. But it's not our fault. Sorry if that went a little too emotional, but it's a huge problem.
No, we appreciate you sharing that with us, Dr. Stevens. And that is something that those of us who are considering a career in veterinary medicine should know, or those of us who just obviously have enough exposure and interest about that career to be listening to this session. Not to cause that doorway transition that you spoke about, but we had another question come in, and that was, what's the coolest or strangest, weirdest animal that you've seen on your job? And I guess I will say in my time with Dr. Stevens, it was ferrets that we had running around town, that someone's ferrets had gotten loose. But I know Dr. Stevens has seen a lot cooler ones.
Yeah, I'm not a huge ferret fan. I know Shelly and Shelby are, but I could deal without ferrets pretty easily. But yeah, we get a lot of different things. I will say that I will see anything as long as it's got legs. So I do not see snakes because they are unnatural without legs and they're gross. So I will not see snakes, but I see everything else. So I've seen hedgehogs. I have a producer that has a kind of an exotic hobby farm. And so he has zebras and he has emus and he has camels and fainting goats that he likes to chase and clap his hands and they fall over. And So we see a lot of different species, but those are probably my favorites. Right now, he just had a donkey that gave birth to, no, not a donkey, sorry, a mammoth mule, or a mammoth donkey that gave birth to a zebra cross. So it is like donkey colored with stripes on it. It's pretty cool looking.
Interesting. And along those lines, another question that came is, do you know any exotic animal veterinarians?
I do. Yes. I have a friend down in Petersburg that likes to see exotics. And then there is two in Peoria that see exotics. There is a veterinarian that I work closely with in Peoria that sees a lot of zoo animals as well. So.
Awesome. Alrighty. And one of the questions that came in briefly after you had spoken a little bit about some of the value of keeping that GPA up by maybe looking at a community college is, to your knowledge, do vet schools have a different outlook if they've seen someone who has gone to community college versus coming out of a four-year program?
No, not at all. The application process, when you actually look at, or when I applied, and I'm sure it's the same still, you do get an extra point. So like University of Illinois, because I finished my bachelor degree there, and then I applied to veterinary school at U of I did get an extra point on my application because I was an Illinois graduate already. But no, I mean, there's no downside to going to a junior college if you're looking to go to vet school. It's always up, in my opinion.
Wonderful. We love hearing that. And I would encourage you all, if you have any other questions, please send them in the chat box. One that I hoped you could share with us a little bit is, what recommendations do you have for high school students who are considering a career in veterinary medicine?
Yeah, another challenge that our industry has is student debt ratio compared to what they make. So starting veterinarians make about 65 to 80,000 a year, which sounds like a lot of money, but it is not when you think of their educational debt. Most veterinary students coming out of school have an educational debt between $250,000 and $300,000, and so that is significant. When I graduated veterinary school, my starting salary was not that high because I was starting in rural Illinois. But my student loans still have to be paid. And so I was paying $1,900 a month in student loans. And that can really eat up someone's paycheck, a lot. And so I think that knowing every single detail about the industry in which you are wanting to go into is very, very important. So like I said, shadowing is really important. As the young lady was talking about, the emotional stresses that come with the career, knowing where you want to end up is very important. So there's a lot of things to consider when you are wanting to do veterinary medicine. But I think getting into a clinic and really figuring out whether it is something you want to do is very important. The first day of vet school, they had us raise our hand and they're like, okay, how many of you guys have ever drawn blood from an animal? They didn't care what species, they didn't care, what kind of animal it was, but they just wanted to know how many of us did it. And I was shocked. There was 25, maybe 30% of us that raised our hand. And how do you know that you want to do the job that you're wanting to do for the next 60 years of your life if you don't get into it right away? Like if you don't immerse yourself as a student, how do you know that that's what you want to do? So I think it's really, really important.
Absolutely. And how do you recommend someone initiates that conversation with maybe their local veterinarian?
Yeah, I think a lot of students initiate it with me while they're visiting their family herd, or even if they bring their pet into the clinic for an annual exam. I have parents all the time asking me, are you seeing shadowing students? And we've even gotten to the point where we are asked that so much that we have an application process now for our shadowing students, because I encourage anybody that has an interest in veterinary medicine to come check us out. But if you are just wanting to see what the industry is about and not necessarily a career in it, I'm fine if you come 1 or 2 days. But those students that really want to be a veterinarian, heck, they're here 3, 4 times a week. And those are the students that I really want to cultivate, I guess might be the right word, that interest, and make sure that they really are truly serious about it and they see every single part of the industry. So, and we have people just call too, but most of the time those interactions are made face to face.
That's great to know. I think we have some future potential veterinarians on this call that'll be a good news for them to know that it's as simple as that ask, and being able to communicate what your expectations are from that experience. And yes.
And the student needs to ask, not the parent, the student. That drives me crazy when parents call and say, my daughter wants to be a vet. Well, then have your daughter call me.
Yes, absolutely. And don't be afraid to do that. You all took the initiative to sign up for something like this, which was an easy step. It was an online registration, but hopefully this is that confidence boost you need to do that. The questions in the chat are kind of slowing down. So I would ask, I kind of have 2 more that relate. And then I'll make that final call for questions, and then we'll let you get back to your day, Dr. Stevens. So simply, what is your favorite thing about being a veterinarian?
Honestly, my favorite thing is, this is going to sound really gross, but it's part of my life. When I pregnancy exam a cow that is close to calving and that calf sucks on my finger, I think that is just the coolest thing in the entire world. I just go bonkers over it. I just love it. It's just so fun. But I've also been in experiences where in the dairy industry, especially, you artificially inseminate most of the cattle that you work on. And so I've had a lot of experiences where I've bred or artificially inseminated that cow, and then I've helped deliver the calf, 285 days later. And that's so super cool to see your efforts really pay off. Or go past a producer's pasture and see all the calves jumping and playing, and you had a hand in that. It's really cool, really super cool.
That's wonderful to hear. And I hate to end it on this note, so hopefully another question comes in, but what would you say is your least favorite thing about being a veterinarian? And maybe you already touched on some of those things.
Yeah, I think Dr. Google is really hard. Everyone's an expert now, and heck, I could even do your job, Shelby. I just have to Google how to do it, right? But everyone being an expert, I think, is really, really difficult. And telling professionals how to do their job. I don't go to my mechanic and say, it's got to be that wheel bearing. I just know it. You just let the professional do their thing. So I think that's really difficult. I think the amount of information that's out on the internet that is false is very difficult. When I started my interest in veterinary medicine, the amount of dog foods and cat foods that were on the market were very minimal, and now there's a gajillion of them. And not to pick on this industry, but everyone's an expert when it comes to nutrition, except for the people that actually should be writing the blogs and should be writing the websites or not. So a lot of our clients, they like to talk to us about nutrition, which I appreciate. But they're looking at sites like dogfoodadvisor.com, which is a very common site for people to look at, but it's written by a human dentist. And so, why are people citing that site? And why? It's crazy to me. So that's a struggle.
Okay. And can you briefly just outline this is another question that came in, and I'm glad, because I don't want to end on that negative note. You talked about a couple of the different roles. Can you talk about the educational requirement for each of those?
Yep. So we'll start at the bottom. So you can have just on the job trained assistants. And so those assistants do not have to have any educational career or degree at all. And you just train them how you want them. And I'll be quite honest with you, I have those people in my office and I would not trade them for anything. They are valuable, valuable team members. They've been in this clinic for years. They know my clients well. They are trained by me, so they do things the way that I'd like to get done. And I have one as an office manager right now, and I would put her against some of the trained individuals very, very quickly. She knows her stuff and she is very, very, very good at her job. So that's on the job trained. Veterinary assistant is a 1-year program, 1-year college program. Veterinary technicians is a 2-year college program after prerequisites have been met. So typically it does take students 3 years to get through a veterinary technician program, just because of the year of prerequisites first. And then when you jump up to being a veterinarian, you go to 4 years of undergraduate, 4 years of veterinary school, so 8 years. And then if you want to be board certified, that's another 4 years on top. So that's a career path of 12 years.
Wonderful. Thank you. I invite you all now, if you have any final questions, to either send those in the chat box or unmute. I will be putting a survey link in the chat box as well. I ask that you do that before you get off today. It is very brief. It'll take you, I promise, literally 2 minutes, maybe less. And it is mobile friendly. So if you're listening and if you don't have any final questions, I'd ask that you all just join me in thanking Dr. Stevens for her time today. We can see how busy the clinic is going on around her, and we appreciate her sharing all this wonderful insight into the field of veterinary medicine.
Thanks, Shelby, for the opportunity.